And we are back. This is Dr. Arthur Perry. This is What's Your Wrinkle right here on WABC, where the signal travels all the way from Maine way down to the Keys in Florida. And boy, I'll tell you, we've got millions of listeners out there. And tonight, they're listening to Dr. Bruce Haffty, who is the Chief of Radiation Oncology at the Robert Wood Johnson University Hospital. He's the professor and chairman of the Department of Radiation Oncology at Rutgers Cancer Institute and at Robert Wood Johnson. Are you there, Dr. Haffty?
Yes, I'm right here.
Well, thanks so much for taking time on your Saturday evening. You know, it's always a pleasure to have the Robert Wood Johnson faculty, the Robert Wood Johnson clinicians on the show, and particularly it's a real pleasure to have you. Now, Dr. Haffty trained at Yale. He got his medical degree at Yale, and he did his residency there. He's one of the best doctors in America, and not just said by me, but he's been named by Ladies' Home Journal and Good Housekeeping and so many other publications as one of the best in the country, and I'm happy to have you on the air tonight. Now, Robert Wood Johnson is excited to announce the arrival of its first proton beam radiation center, and it's the first one, I guess, in New Jersey, the first in the New York, New Jersey area. Tell us about this.
Well, we're fortunate in having the first of this type of a proton machine, which is essentially, and the main difference between this and previous versions is that it's really size and cost. So this traditionally proton beam centers have the footprint essentially of a football field, take up a lot of space, and literally cost $150 million plus. This new model, and that model, has been around for 10 to 20 years, but it's so financially difficult to put a plan together that would work. That this company called Mevion now created really a smaller version, a single room proton beam, which can fit in a more traditional radiation therapy department. And costs about a quarter of the price, and so that's the main difference.
All right, so Robert Wood Johnson has this new machine now. Listeners out there don't know the difference between proton beam therapy and all of the types of radiation therapy. So this is new. Tell us about proton beam. Why is it better, and when do we use that as opposed to traditional radiation therapy?
Sure. Well, so the first thing I think that people should realize is proton beam therapy is really another form of radiation therapy. And just like really any, whether you're a surgeon or an internist or a medical oncologist, or you have many tools at your disposal for being able to treat what you're trying to treat. Just listening to your program earlier, you talked about various methods of in terms of plastic surgery, and you want to have all the tools available to you. So how I look at it is proton beam is simply another radiation tool that we can use in the treatment of cancers primarily, and it's different from conventional radiation, if you will, in that the beam, rather than going through, when you aim a beam or an X-ray beam at somebody, you point it at the tumor, it goes through, but there's a certain amount of dose that exits on the other end. And proton beam allows you to put the radiation in, but it doesn't exit. It drops all of its energy and all its radiation at a certain point, and there's no exit dose. What that allows you to do is, in certain situations, be able to treat a tumor and not have as much, if you will, collateral damage. In other words, damage to an organ behind the tumor or on the other side of the tumor, because you've dropped all the energy and all the radiation at the tumor, and there's no exit dose. And so for certain situations, that is advantageous in terms of being able to treat a tumor and have less effect to the surrounding tissue. However, I would say that it's very important for the patients to realize that proton beam isn't the right tool in every situation. And so we're fortunate at Robert Wood and at the Cancer Institute in New Jersey is now to have all of the tools available, whether it's a conventional radiation, the gamma knife, what we call brachytherapy, all kinds of tools, and the proton beam is an added tool. So when the patient comes in, we can determine is proton beam right for this patient in this situation. So it does offer advantages, but I think the message that I would give to patients is best to talk to your radiation oncologist about which modality is right for you in your situation.
Well, my guest this evening is Dr. Bruce Haffty. He is the Chief of Radiation Oncology at Robert Wood Johnson University Hospital at the Cancer Institute of New Jersey. And if you don't know where this is the place in New Jersey. And I'll tell you, this interview is just another example of that. We've got a wonderful new machine, this proton therapy machine at Robert Wood Johnson. Robert Wood Johnson is in the geographic center of the state. So if you take a map of New Jersey, put your finger right in the middle, you'll hit Robert Wood Johnson. Dr. Haffty, thank you so much for being my guest. I want to give out the phone number. It's 888-MD RWJUH if you're interested in this technology. You can go to the website, by the way, rwjuh.edu. That's rwjuh.edu. They've got all sorts of information about this technology, about radiation oncology in general, and it'll give you enough information so you can help make decisions if you have the diagnosis of cancer or a loved one does also. Once again, 888-MD-RWJUH is the phone number at Robert Wood Johnson. Thanks so much, Dr. Haffty. You've been a great guest. And once again, this has been What's Your Wrinkle right here on WABC in New York. During the week, you can give me a call at 732-422-9600. Thanks so much for great engineering, Mike. We'll see you all next week.